Hi, my name is Whitney and I'm a dental hygienist here to talk about what to do if you don't have dental insurance or if you currently can't afford to see a dentist right now. What should you do? I need to start by saying I have another video that goes over ways to get affordable and sometimes even free dental care. So after you watch this video where we'll go over what you can do at home, I highly suggest you watch that other video of mine as well, because there really isn't anything you can do at home that can completely replace the dentist. Yes, there are many tips and tricks to lower your chances of needing a dentist for dental work, such as fillings, crowns, root canals, dental procedures, tips to avoid all of that stuff, which we'll go over in this video. But preventative dental checkups and cleaning appointments are really truly necessary in keeping your teeth and mouth healthy. So please check out that video of mine to find out ways to get affordable and sometimes even free dental care by finding dental clinics, dental schools, different dental programs in your area. Access to care can be difficult in some areas, but that video of mine comprehensively goes over ways to find dental care within your budget. Until then, if you are skipping the dentist due to finances, of course I never recommend it because a routine dental cleaning is the #1 thing that will save you money in the long run. But I understand things happen. So until you're able to get back to the dentist, my best advice is to keep up with your home care by using proper dental habits and techniques at home, starting with #1, a toothbrush. It seems so simple, yet toothbrushes are often used incorrectly. So to make sure you're using it right, to properly remove plaque from your teeth daily, you can watch my how to correctly use a toothbrush video, which I'll link below. And also a quick tip for right now is to always be gentle. Never use a medium or firm toothbrush. Always use a soft or extra soft bristled toothbrush, and be sure that you're brushing for a full 2-minute brushing session, a full 2 minutes twice each day. So once in the morning and once at night. A great technique is to use gentle circular motions while angling your toothbrush 45 degrees toward the gum line. So angle it up toward the top teeth and down toward the bottom teeth, ever so slightly, while using gentle motions. This way you won't miss the gum line, an area where most plaque likes to hide. So be sure to brush all the tops, all the bottoms, and all the sides, the insides, the outsides of every single tooth in the mouth. Again, for 2 minutes twice each day. You also should be using a fluoride toothpaste, since fluoride is proven to effectively remineralize teeth, thus strengthening the enamel to prevent teeth from decay. Cavity prevention. Most of the big brands will have fluoride in their toothpaste. If you're unsure, check to see if the ADA seal of acceptance is on the tube. If it is, then you know you're good. It has been tested for safety and efficacy. They do sell ADA approved toothpastes at the dollar store. Very affordable. #2 is floss. Unfortunately, floss is commonly used incorrectly as well, if used at all. So make sure you floss at least once each day before bed being the most optimal time, and you never just want to pop the floss in and out. Even more importantly, you never want to floss with the seesaw motions. The seesaw motion is the insertion motion, but the cleaning motion is actually up and down. This is where you hug the tooth and go up and down to the left and then up and down to the right, making sure you're really wrapping around each side of each tooth, cleaning all the sides of all the teeth. And most people really should try and work hard to use the correct flossing technique, because when you're flossing properly, adapting the string to the sides of each tooth, you can effectively remove plaque from between your teeth and stimulate your gum tissue, thus reducing your chance of cavities and gum disease, keeping your teeth healthy. I always remind my patients that the part of your tooth that is between your teeth, that part actually makes up for about 40% of your tooth. So if you're only brushing and you're not flossing, you are literally missing out on cleaning 40% of your tooth, which is a huge number, right? Like if I were to get a 40% off coupon at the store, a 40% off discount code while shopping, I'm definitely going to use it. I wouldn't just say, oh, forget it, right? It's a huge portion. So you get it. Flossing is very important and it could save you both time and money. And if you are struggling with a traditional string floss, I will also link my floss pick video if you prefer those to make sure you're using them correctly as well. #3, stay on routine. Never skip a night of brushing or flossing. Just missing one night can set you up for failure, since plaque can start hardening into tartar within 24 hours. The reason this is bad is because tartar provides an even more serious irritant for the gums than plaque. Again, plaque is the stuff you can brush and floss off at home, but tartar is hardened rock-like plaque. Plaque by itself can cause inflammation and irritation to the gums around the teeth, leading to gingivitis, red, swollen, bleeding gums. But when gingivitis is not treated, aka you're not properly removing removing this plaque from your teeth daily with brushing and flossing, it can progress to tartar and periodontitis and possibly tooth loss, especially if you're not going to the dentist regularly. This is because proper removal of tartar needs to be done by a dentist or a dental hygienist. You can brush and brush and brush until you're blue in the face and tartar will not come off properly at home. You need to go to the dentist for a professional cleaning with professional tartar removing instruments for it to properly come off. So until you can get back to the dentist, you need to do all you can do to prevent that plaque on your teeth from forming into tartar. And if you're keeping up with your teeth at home, there will be less tartar building up, less chance of dental disease to form. So try your best to stay on routine. Step 1 is, of course, getting the proper technique. Step 2 is routine. You need both to succeed, right? Because you can have all the techniques down pat. You're a wonderful flosser, an amazing brusher, but having the skills without creating a habit means nothing, right? You've got to stay on routine. If you're struggling to form brushing and flossing habits at home, I'll also link bettermouth.com. It's a tool to help dental home care feel less like a chore and more like an act of self-care. It has you take a quiz to personalize what you want to work on, in this case, building a routine, right? And then you start your Better Mouth journey. And also, don't forget to watch my affordable dental care video and find out ways to access a dentist in your area. And if you're interested in creating the best oral care routine at home to prevent major dental issues and costly dental visits, make sure to follow the steps we talked about in this video: proper brushing, proper flossing, and staying on routine, and challenge yourself today to start forming those habits. And also, if you want to click the link in the description, I'll also have a link where you can sign up for my free oral care guide. It has even more details on ways to keep your mouth healthy at home, including which foods are best to eat, worst to eat, focusing on technique demos again, as well as talking about the benefits of additional tools you can use at home, such as tongue scrapers, water flossers, proxy brushes, and more. So to discover all of the essentials for an effective oral hygiene routine at home, click the link below for my free guide to prevent and maintain a happier and healthier smile until you're able to get back to the dentist. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.